Dr. Ken Landau. Thanks for watching. Let's talk about alcohol liver disease. Alcohol consumption is the 7th leading cause of death in the United States. Causes about 6 to 8% of deaths in men, 2.5% of deaths in women. And unlike the common stereotype of alcohol causing problems in 50, 60, and 70-year-olds, actually it has a disproportionate effect on young people. The largest incidence of alcohol liver disease occurring in people between the ages of 25 and 34. So if we look at alcohol-related deaths, about a third of them come from alcohol liver disease. And if we look at alcohol liver disease, it's the major cause of chronic illness due to alcohol. Just between 1999 and 2017, 1 million U.S. citizens died because of alcohol. Alcohol is the major cause for liver transplants in Europe and the second leading cause for liver transplants here in the United States, second only to hepatitis C, and hepatitis C now has a cure. So within the next year or two, it's estimated that alcohol liver disease is going to be the major cause of liver transplants here. Now, when we talk about alcohol liver disease, there are a group of conditions that fall under the umbrella. Alcohol liver disease seems to affect somewhere between about 4 and 15% of the population. Sometimes it's symptomatic, sometimes it's asymptomatic. So the conditions that are typically thought of as comprising the family of alcohol liver disease, fatty liver or steatosis, that affects anywhere between 3 and 16% of the population. There's alcoholic hepatitis, alcoholic steatohepatitis, if you will. That's much more severe condition associated with symptoms oftentimes of hepatitis, but may be asymptomatic. And then we have cirrhosis of the liver. That's where there's scar tissue in the liver, fibrosis. That occurs in about 1% of the population. And in some people, there's progression from alcohol liver disease to hepatocellular cancer. That's liver cancer, primary liver cancer, not cancer that started in the breast, went to the liver, or in the intestine, went to the liver, but actually starts in the liver. Now, if you develop alcoholic steatosis, that's fatty liver, it's 100% reversible. As a matter of fact, the overwhelming majority of people who have alcoholic steatosis don't even know it. On the other hand, the second form, this alcoholic steatohepatitis or alcoholic hepatitis, that's reversible but not totally reversible. Maybe asymptomatic or maybe symptomatic. We do know if you continue drinking and you have alcoholic hepatitis, it may progress on to a relatively severe condition, a condition from which about 40% of people can die. So that's relatively serious. So how much alcohol do you have to drink to develop fatty liver? And the answer is we can't say. We know that you can drink 4 drinks or more, and chances are overwhelming you'll develop alcoholic steatosis. On the other hand, what about 2 drinks a day? Some people actually do. What's a standard drink? Standard drink's 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of liquor. It's not a linear progression. It seems that, the reason that the limits have been set, as if you're a woman you shouldn't drink more than 1, if you're a man you shouldn't drink more than 2 drinks a day, that's because somewhere over that limit, that's when the liver starts to become negatively impacted. Now, is daily drinking or is binge drinking worse? Well, over the course of time, we've always thought that daily drinking is worse, but binge drinking is becoming a lot more common, or at least we're recognizing it a lot more commonly, and as a result, it seems that it can cause a lot of liver disease too, but not all people are alike. So, for instance, the same amount of alcohol consumed by a person who is either obese or overweight, diabetic, a person has hepatitis C, or a person carries a genetic mutation. Those people are inordinately sensitive to relatively smaller amounts of alcohol than people who are normal weight who don't have diabetes. As a matter of fact, if we look at diabetes, we find that about 20% of all cirrhosis occurs in diabetics, and about a third of all alcoholic liver disease occurs in diabetics. When we look at the pathology of the liver, when the liver is insulted for any number of reasons, one of the first things it does is it starts to accumulate fatty acid, the hepatic steatosis. Know that it occurs universally if you're a heavy drinker, and if you're a moderate drinker, you have about a 40% chance of developing fatty liver. Fatty liver occurs in the central area where the blood comes in from the stomach and the intestines. That's the area of the central vein. You can look at the liver sort of as lobules, and they all are like a pie, and it's that central area where the blood comes in from the liver and the intestines. That's the area where the metabolism of alcohol first begins. That's the area that's subject to accumulation of fat. Well, the fat tends to occur in big globules. So it's what we call macrovesicular steatosis, big globules of the fat. And they tend to be around that central vein, but if you continue to drink, it's going to spread throughout the entire liver lobule. Now, what is fatty liver? It's fatty liver when the liver accumulates and synthesizes some fatty acids, and then it takes a bunch of the fatty acids and puts them on a little glycerol molecule, and that's when you get triglycerides. So the triglycerides are what make the fatty liver. And it occurs relatively quickly. It's not associated with any symptoms. You're not aware of it. You don't have any problems with any other organ system in the body. It's just you develop the fatty liver, and you can go for a long period of time and have no symptoms, no consequences, but it could progress. It could progress to the cirrhosis of the liver, or it could have that intercurrent alcoholic hepatitis. Who's at risk of progression? Well, women seem to be more than men. If you continue your excessive drinking, certainly that seems to be a problem. If the fatty liver isn't confined just to that central area, but now spreads throughout the entire liver, you're more at risk. And if you have a combination of not only those big globules that we typically see, the macrovesicular steatosis, but we have small microscopic granules, yeah, you're more at risk. About 3% of people with alcoholic steatosis progress every year to alcoholic cirrhosis. Now, people who have the steatosis, as I said, they don't have any symptoms, but they are at greater risk than the general population of dying. The risk of non-liver death is about 4% a year. Liver death is about 1% a year. The cause of death oftentimes is cancer, ischemic heart disease, or diabetes. But the condition itself is considered relatively benign. Unfortunately, it can be progressive. Alcoholic liver disease, or the steatosis, well, that's not really specific for alcohol. You could get it just because you're overweight. You're too fat. And then the fat accumulates in the liver. Or maybe you have insulin resistance. Or maybe your triglycerides are too high in the bloodstream. Maybe you're malnourished. It seems interesting, but malnutrition can cause fat to accumulate in the liver. Or certain kind of medicines can cause the same kind of problem. Well, if you drink too much, this may be a consequence. But you could develop even a worse condition. And a worse condition would be alcoholic hepatitis. Alcoholic hepatitis can intervene at any time. So we don't exactly know why all of a sudden it seems to develop in some people. You could be drinking the same amount you normally drink, and all of a sudden you can develop the alcoholic hepatitis. But the alcoholic hepatitis can be completely asymptomatic. You don't have to have any manifestations because you have some inflammation in your liver. But you could have some symptoms. And the symptoms could be mild. They could be like the flu. You could have maybe loss of appetite, a little nausea or vomiting, a little bit of fever. Or you could get a little bit further. You could look like you have what we call the SIRS. Not the SARS, but the SIRS. SIRS stands for Systemic Inflammatory Response Syndrome. So in this condition, the heart rate's up, the respiratory rate's up, the temperature, body temperature is up. White count is abnormal. You can develop some abdominal pain. And some people can go on and they develop some weight loss, or if you drink heavily, you can have malnutrition. You can lose your muscle mass. Your abdomen becomes distended. Some people become jaundiced, and you can develop some of the changes that we typically think of as being associated with cirrhosis. You can see some dilated blood vessels on the surface of the skin. You can have some varices, dilated vessels at the bottom part of the esophagus, the upper part of the stomach, the last part of the intestine. And then some people can develop some bleeding from those areas. Now, unfortunately, even if you stop drinking, some of the damage seems to persist, so it doesn't completely go away. We can make the diagnosis of alcoholic hepatitis, alcoholic steatohepatitis, with some blood tests, but they're typically non-specific. So people develop anemia, sometimes a white blood cell goes up, sometimes the albumin goes down. If the liver is malfunctioning, it's not manufacturing the factors necessary to clot, and then you might start bleeding a little bit excessively. In some people, the liver function tests are up. They're up less than typically with a standard kind of hepatitis that you would get hepatitis A or B or C. But they're often elevated 2 to 7 times the normal value, with one of the chemicals known as AST being about 1.5 times greater in elevation than the ALT. That's the way we make the diagnosis, but the history is obviously very important. If you don't say that you've been drinking, if we don't elicit that history, then you have hepatitis, and we have to do a bunch of tests, and oftentimes it's very difficult to make the diagnosis specifically that it's due to alcohol. Well, when you do develop alcoholic hepatitis, it is hepatitis. There's inflammation and there's death of some of the liver cells. How much do you have to drink? Well, we can't really say. But we can say at least that people who drink more heavily are seemingly more at risk, but there's a threshold of about 3 or 4 drinks a day. More than that, well, if you drink a lot more than that, you have more severity of the alcoholic hepatitis. You don't necessarily have greater prevalence of the condition. It seems to top out at about 10 to 30% of drinkers. It's kind of like cigarette smoking. Not everybody who smokes excessively, whether you smoke 1 pack or 2 or 3 or 4 packs a day, is going to get lung cancer. It seems to top out at a certain rate. And it's not necessarily related to the amount. But some people are just more prone to develop the condition. So remember, it can range anywhere from totally asymptomatic to progressive deterioration and death. If you do develop alcoholic hepatitis, you have about a 10% per year risk of going on to develop cirrhosis of the liver. If we were to biopsy the liver in a person who had alcoholic steatosis, the fatty liver, we just find fat. If we biopsy a person who has alcoholic hepatitis, now we see inflammation in the liver. Yes, we still see some of the fat, but now we see ballooning cells and large cells that are in the process of dying. And then all of that can end up causing significant consequences, significant long-term consequences. So if we look at a person who has alcoholic hepatitis, and the person stops drinking, the survival rate, say at 3 years, is about 90%. You continue to drink, it's less than 70%. And overall, if you have alcoholic hepatitis, even if you stop drinking, well, the hepatitis probably is going to get better, but your life expectancy is going to be less than it would be otherwise. The death rate is about 7% per year of liver-related causes and about 4% of non-liver-related causes. Now you can go on a little further. You can develop cirrhosis. Cirrhosis just means that the liver basically has been infiltrated by scar tissue. And when you get that scar tissue, the fibrosis, it interferes, number 1, with the cell function of the liver, and number 2, with the ability of the blood to come from the stomach and the intestines through the liver, that has to go through the liver, and then get into the portal vein to go back to the heart. Well, if it can't go through the liver, it has to find other ways to go. That's what we call portal hypertension. And portal hypertension is often associated with some degree of liver failure. The liver doesn't detoxify the chemicals that you consume or that the body manufactures in the process of metabolism. About 10 to 20% of heavy drinkers are going to go on and develop cirrhosis. And cirrhosis, yes, can occur both from daily drinking and from binge drinking. 3 or 4 drinks a day, if you do that on a regular basis for a long enough period of time, that seems to be enough. Now, if you drink even more, is that going to increase the risk? Well, it seems to be sort of a plateau. But we do know that over the period of the past 20 years, the rate of cirrhosis of the liver has increased by about 65%. Inflection point seemed to occur around 2009. 2009, when we were having the severe economic crisis here in the country. That seemed to be a takeoff point when the incidence of cirrhosis really increased quite dramatically. Well, why do you get cirrhosis? Seems that it's caused by accumulation of a byproduct of the alcohol metabolism called acetaldehyde. And the acetaldehyde does a whole bunch of things that are harmful to the liver. Well, if we examined a person who had cirrhosis, would we find any abnormality? A person can have no abnormalities and have cirrhosis of the liver. You don't have to have any kind of complication. You can have what we call compensated cirrhosis. And compensated cirrhosis, we look at you, examine you, everything seems to be okay. You go get your annual physical exam, oh, you're okay. But some people with cirrhosis are going to develop some evidence, and they're going to have some enlarged blood vessels. We call them spider angioma, that are on your face or on your chest or on your upper arms or your back. And some people are going to develop red palms, and some people are going to develop decreased amount of body hair, men increased size of the breast, can have some clubbing of the fingers, the nails, going to have wasting of the muscle in some people. Dupuytren's contracture used to be thought of as being just due to alcohol. Now we know it's due to a variety of causes. The testicles can atrophy. Liver tends to be relatively small. It's relatively large when you have an accumulation of fat. But over a period of time, as you develop cirrhosis, the liver tends to shrink in size. Sometimes people with cirrhosis develop accumulation of fluid inside the abdominal cavity. We call that ascites. Sometimes people are confused, stuporous, all depends. Well, in the absence of your completely stopping drinking, if you have cirrhosis, then the progression is typically to liver failure. And certainly if you have liver failure, then that's incompatible with life. And you're going to have a variety of complications, from neurologic complications to fluid and electrolyte complications to bleeding complications, all of that because the liver malfunctions. And the liver is a very important organ in the body. So one of the things that happens is if the blood can't get through the liver back to the heart, it's going to pick some other ways. And when it picks the other ways, that's when you get the dilation of the blood vessels at the bottom of the esophagus or around your rectum. Then you can have some gastrointestinal bleeding, and that's very common. You can vomit blood, bright red blood, or you can pass blood through your bowels. And some people, if they have problem with the liver, can't cause the blood to coagulate. Other people going to get big dilated veins inside the abdominal cavity. That's when the fluid starts to develop. And if you have cirrhosis, your chance of dying is about 6% per year, and about 3% per year going to progress on to the hepatocellular carcinoma, the liver cancer. That's somewhat less than with viral hepatitis. Now, it's important to realize that even though we can go from the alcoholic steatosis to alcoholic hepatitis to alcoholic cirrhosis, you don't have to have that middleman. So you don't have to have the hepatitis, the alcoholic hepatitis. You can go from alcoholic steatosis that you didn't know you had to the alcoholic cirrhosis that you don't know you have. You can pass all your blood tests. And then all of a sudden you get hepatitis C, or you get a prescription for an antibiotic to treat an infection. And it can't be metabolized through the liver, and that can cause significant problems. Well, over a period of time, we've learned a lot about the way alcohol is metabolized in the body. And it seems that the alcohol is metabolized with some enzymes, and the enzymes happen to be in that central part of the liver. And when those chemicals first attack the alcohol, changes the alcohol into acetaldehyde. And then subsequently the acetaldehyde in the same area of the liver is going to be changed into basically acetic acid. But that acetaldehyde, when it's sitting around, it attaches to some of the normal constituents of the liver. And then the body makes a mistake because it's not used to seeing those normal parts of the body associated with the acetaldehyde, so it thinks they're foreign. And then as a result, it attacks those substances. And when it attacks those substances, and when the oxidation pathways are insulted and you start manufacturing a lot of hydrogen peroxide and the superoxide anion, all those reactive oxidants, well, that causes further damage. And the further damage ends up causing destruction of the liver cells. Now, even though we think of alcohol as the primary culprit, we're learning that in a large majority of people, if not all people, who have cirrhosis and have these alcoholic-related liver conditions, it may well be that the alcohol changes the intestine, the lining of the intestine, and allows a bacterial constituent to leave the intestine. And when it leaves the intestine, it gets into the portal circulation, goes right to the liver. And those lipopolysaccharides that line the outside of some of the gram-negative bacteria, a lot of the bacteria that live in the intestine, when they get to the liver, they insult the liver and they cause the production of those oxidants and the cytokines and all of the other substances that stimulate the body's immune system, and then we have an inflammatory reaction. And it seems that the type of inflammatory reaction that we have parallels the amount of the lipopolysaccharides that are coming out of the intestine. So it's not just the alcohol itself. That's why it's so difficult to say how much alcohol do you have to drink to get alcoholic liver disease, when indeed one of the major components is an intestinal component. And then we have a decreased amount of glutathione, and then the endoplasmic reticulum inside the liver cells, well, it doesn't fold the proteins right. And overall, we have a major issue. Now, how do we treat the condition? Well, if you have alcoholic steatosis, it's stop drinking, but you don't even know you have the problem. If you have cirrhosis, we don't really have any treatment for cirrhosis. If you have the alcoholic hepatitis, well, it seems that steroids for some individuals may improve the condition. But the question is, how long and how much? Well, if you get some prednisone, and prednisone is just like the drug you've been hearing so much about lately, the dexamethasone, that's now supposedly the cure for severe disease in COVID. Well, if you get 28 days worth of prednisone at a dose of 40 milligrams a day, it's going to increase survival of alcoholic hepatitis from about 65% up to 85%. But unfortunately, about half of the people have a contraindication, a relative contraindication. So there's a good reason not to give them the prednisone. So people who have diabetes or gastrointestinal bleeding or kidney failure, those people probably have reason not to take the medicine. And even if you do take the medicine, there are only about 50% of the people who receive the medicine going to get any significant benefit. Well, if you have the alcoholic hepatitis, or if you have cirrhosis of the liver and it's decompensated, we want to make sure you're getting enough calories. We don't want you to be malnourished. You need the protein and you need the calories both. So feeding is very important, hopefully through the mouth, even if it's a nasogastric tube, much better than if you're fed intravenously. What about probiotics? There's no evidence that they really help. Interesting, some of the studies are now showing that for treatment of alcoholic hepatitis or cirrhosis, maybe, for the hepatitis, not the cirrhosis, but for the hepatitis, it may be that fecal transplant might provide some useful bacteria that can cut down on the inflammatory reaction. Now, there's another situation with alcohol. So If you have some other condition that's causing liver problems, so let's say you're just very obese, and if you're obese, you could have non-alcoholic fatty liver disease, exactly the same thing as alcohol fatty liver disease, except you don't drink alcohol. Or maybe you had hepatitis B or hepatitis C and it damaged your liver. Or maybe you have drug toxicity from taking amiodarone for your heart, or you took too much vitamin A. Well, those people are at high risk if they continue to drink. So you could develop what we call acute on chronic liver disease. And that's associated with increased organ failure. And it has a bad short-term prognosis. What other kind of treatments do we have? Well, at least at the present time, a lot of things have been tried, but none of them seem to be effective. But for those individuals who have end-stage liver disease, it's possible to transplant the liver. And the survival of liver transplants with alcoholic liver disease is the same as with non-alcoholic liver disease, but it all depends on the condition. So if the alcohol has created significant toxicity to other parts of the body, and it's not just the liver, well, chances are you're not going to do very well. So most places require at least 6 months of sobriety and a psychiatric evaluation before the liver transplant. It's not just for alcoholic hepatitis, but it's once the complications of the alcoholic hepatitis or the cirrhosis become apparent, the ascites or the hepatic encephalopathy, where those chemicals aren't detoxified in the brain, aren't detoxified in the liver and get to the brain. Or if you're bleeding from your varices at the bottom of the esophagus or in the intestine, or people who develop the ascites, the fluid, and then get infection, we call it spontaneous bacterial peritonitis. Basically, that's the story of alcohol liver disease. Unfortunately, it's a very common condition. It kind of sneaks up on you. You can drink without obvious problems, without obvious complications, but it's lurking in the background. Then all of a sudden, seemingly for no reason, you've been doing everything the same. You've been drinking the same 3 or 4 drinks every day, and now all of a sudden you have a problem. You have the alcoholic hepatitis, and it's symptomatic. Or you've developed a problem with cirrhosis of the liver. Remember, these things just seem to occur. So what's the safe level of alcohol that you can consume? Well, the idea is that 1 drink a day for women and 2 drinks a day for men. But when you really get down to it, best amount of alcohol to consume as far as your general health is concerned? Actually, it's 0. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.